As families prepare for another school year, there's more to think about than those backpacks. Joining us now is DAP Health Director of Pediatric Services, Dr. Jasmin Brown. Welcome.
Hi, thank you for having me.
This is an important subject. Back to school health. Why is that so vital for parents to talk about?
You know, I'm so glad that we're talking about this today. I think with so much going on right before school starts, summer vacation, so many fun things happening, I think we forget that there are so many factors in our health that can affect how well we're doing in school. A lot of kids have chronic medical conditions that might be poorly controlled or not at optimal treatment goals. Kids that have undiagnosed or unaddressed medical conditions that can affect how they're doing in school. And if these things are factors into how they're feeling every day, really no amount of tutoring or studying might be able to help.
I know a lot of parents who have a hard time looking at their child and seeing that something could be there that needs to be addressed.
Sure.
What is your advice to a parent who might be in a little bit of denial that their child could need medical attention?
Yeah, I think that's a great question. I'll start for myself. My daughter is 5 years old, and she was born with a condition called symbrachydactyly, so she's missing her left hand. And I think for us, the biggest thing that we wanted to make sure we did was make sure she got services, right? And I think in the beginning, there could be some fear associated with the diagnoses or what this means for their future. But not until we started receiving services, talking to other families about how to get help, did we actually find ourselves thriving in her as well. So it can be scary putting a name to something, but once you put a name to something, the possibilities, the treatment opportunities, things can be endless in getting help for your children.
Perfect, and that's just so important for people to know. And what should be on every family's checklist as we head back to school?
Ooh, lots of things. I think the biggest thing I think about is, well, definitely scheduling those annual visits. We call them child checks or annual physicals, sports physicals as well. Right now is a perfect time. Kids, I think, again, we're so busy with fun stuff in summer that we forget to schedule them. And when we try to schedule, there's no availability. So
yes.
Trying to get in as soon as we can and making that a priority. A lot of kids, again, have accommodations at school, forms they need to fill out for medications, treatment plans, and they need these things at the start of the school year. So I encourage parents not to wait, make those appointments now.
Yes, good idea, because then you might not get your chance.
Exactly, and we want to help you, but we only have so many hours in a day, so we do what we can.
What about the common cold that kids are dragging back to school?
Oh, that's fun, yeah. So I tend to tell parents it's a revolving door of illnesses, right? About every 2 weeks. And it's not just during our cough and cold season, you know, in winter time. We still see it in August and in these early summer, spring, or summer, fall months, I should say. Kids are, I love to say, nidus's for infection, you know? They're little petri dishes, and they don't do a great job of keeping their illnesses to themselves. So a lot of things that we really encourage. One, vaccines are a huge part of keeping kids healthy. Again, I always emphasize to my families that if I'm recommending it for your child, it's because I do the same for mine. My 5-year-old has been getting all of her vaccinations since birth, and it's done wonders in, I think, protecting her and other children against pretty scary viruses and bacteria that are around. Keeping our hands clean, you know, I think we all been through it together, right? So we know some of those big things. If we're sick, we encourage families to please keep their kids home. I know it can be a challenge keeping kids home, but if we send them back to school, I think we're not always thinking about other families and their situations,
yes.
Right? And as we are recovering, I actually encourage parents and families, if they can, out of abundance of caution, if they are still feeling a little bit sick, they're recovering but still have minor symptoms, if they could please wear a mask. You know, we can't really tell who's still shedding viral particles that might still be contagious to other people. So whatever we can do to mitigate some of those symptoms as the children return to school.
Wonderful. And what do you think is the most vital piece of information that you could give to parents and families as children return to school?
One of the biggest things is resetting their sleep habits and their sleep patterns before school starts. I think, you know, kids are going to sleep at 2 a.m., 3 a.m., sleeping till 12 in the afternoon, 1 o'clock, and then they try the night before school to go to sleep at 8 o'clock, and it's just not going to happen. So I get tons of kids and families coming in those first few weeks of school saying, my child is so tired all day, they can't sleep. And so I highly encourage getting those sleep routines reestablished at least 2 weeks before school starts, so we're not struggling with fatigue in the beginning of the school year.
Great tip. And also, I just thought of anxiety. Kids get a lot of anxiety going back to school. Change is uncomfortable.
Absolutely.
How do you figure we handle that?
Yeah, I think there are a lot of nerves with new things and experiences. I always encourage families to keep an open line of communication. You know, talking to kids, you know, depending on the age can be hard. You know, kids that can keep to themselves, but really just kind of showing them that you're there and asking them before school starts, like, what are they looking forward to? What are they excited about? And then what makes them a little bit nervous, maybe scared? Maybe some kids have had some bad experiences or had some trouble, you know, with people not being kind to them. And so working with the child to see, you know, one, how significant this is, you know, obviously validating their feelings, but some kids do need a little bit more support, again, from pediatricians or specialists to kind of help them with their mental health if it is that significant. And then I think just talking to kids about, you know, that we can't control the world. We can't control what people say. You know, we do a lot of affirmations with our little girl too, and trying to help them instill that confidence in themselves. And talking to other families, or talking to our children, excuse me, I should say, about how to be kind to others. You know, I think uniqueness and differences are something to be valued and so important in our world, and make it such a beautiful place to be. That talking to our kids about embracing that for themselves and others is so important.
Well, this has been very insightful, Doctor. Thank you. These are wonderful tips. As a parent myself, this has been very useful and helpful.
Awesome. Thank you so much. You're welcome.
A healthy school year starts with prevention. Annual checkups, recommended vaccinations, healthy sleep, good nutrition, physical activity, and emotional wellness all help children succeed, both inside and outside the classroom. To learn more about pediatric and family health care services, visit daphealth.org.